everyone, and welcome to ATP Live. How are you doing? It's another beautiful Monday, and this is an opportunity for us to take your questions live and direct. So, thank you so much, all, for joining me today. I'll soon be joined by one of my moderators. I'm not so sure who is my moderator now. I don't think it's one of the people requesting. All right, so as you're joining us, welcome to ATP Live. This program is brought to you by Ask the Pediatrician's Foundation, and our focus is how to promote, how to reduce deaths of children from preventable causes, and we do this through health education, information online, and as well as offline through our community medical outreaches. So I'm Dr. Gbemisola Boyede. I'll be here today to answer your health questions relating to your children. So if you have any questions, feel free to drop it on the Instagram or YouTube or Facebook or wherever you're watching me from this evening. All right, so welcome everyone. I'm just going to quickly go to put it on our watch party on our Facebook group. Just give me a minute. And I'm still waiting for my moderator to join me. Okay, I think I've seen her now. Okay, I can't add you. Benny, I can't add you. I don't know why. Okay. 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 Uh, Blessing, you need to upgrade your Instagram. You need to update your Instagram for me to be able to add you according to Instagram now. Dominic just putting up all the issues, everything on the watch party. Okay, get ready. And I'm still waiting for my moderator to join me. Yeah, so start dropping your questions. I can see some of your questions coming through. Feel free to drop your questions and then we'll start answering them while we're waiting just a few more minutes for others to join us as well. All right, thank you. Okay. I think my moderator is ready to join me now. Okay. All right. Finally, yes. That's good evening. You're welcome. How are you today? Good evening. Can you hear me? Okay. All right. So, welcome, Blessing. All right. Yeah. So we're going to start right now. I'm just trying to pin the watch party, but okay. I think we can just start. Maybe one of the moderators can help me to pin it to the top so that we can start. Are you ready, Blessing? You seem to be having some distraction in your corner.
I want to get an earpiece.
Okay.
I'm dead. Yes, ma'am. Sorry for that one. I'm set now. Go. I'm set now.
Okay, all right. So I think we're good to go. Welcome once again. This is HTP Live, and today we're going to be answering your questions on any child health issues that you may have. So feel free to drop your questions on whichever platform you're watching from, whether on Facebook or YouTube or Instagram. Just drop your question. So for those on Facebook, I will be reading your questions, while for those on Instagram, Blessing, with our moderator today, will be reading the questions for us. Okay, so we're just going to start straight away right now. Okay, so let's start with you questions on Instagram, and then after that we can take the ones on YouTube. I'll go to Facebook briefly and take some of the questions. So you can read them. Can you see the questions from the top, Blessing?
Yes, I can.
Okay, so you can help us read the first questions there.
Okay, the first one here is from Champagne. Said, my daughter of 17 months always out, or let me say, always puts her hands in her vagina whenever she's not wearing a diaper. Is it normal? It's frequent.
Okay, so that's
of 17 months.
I'm not sure that is that the very first question.
I think so.
Okay, because I think I saw somebody else. Let me just check on my face, on my own hand here.
That's the first I can see after I updated.
Yes, I guess so. So I just want to be sure we missed out somebody else. All right. Okay, but we'll take that. But I just want to show. But I'm really struggling to. No, that's not the first question. Yes, I suspect as much. So Omawumi, yes, don't worry, I will read the first one. Omawumi Ade was asking, when can I start adding salt and seasoning on my baby's meal, because it will soon clock a year. So there's no law that say you can't add salt to your baby's food, even from the time your baby has started eating normal food. The same way you cannot eat like if you're cooking rice for your baby, for example, you cannot cook that rice and not put salt. I mean, there will be no taste. So there's no law that says you should not add salt or you should not put sugar in your baby's food, because I see there are a lot of misinformation when it comes to complementary feeding. You can obviously add salt to taste. What we're trying to say is that you should avoid heavily salted food. And most of these food that are sold in cans, most of the food that are sold that are pre-prepared, that are stored, because they have to preserve them. So most of them are heavily salted. So you want to move away from things that are heavily salted. So a little salt to taste your baby's food, there's really nothing wrong with that. A little sugar to give your baby's pap or anything taste, there's nothing wrong with that. Because if you are giving your baby food that is tasteless, then you will not be surprised when the child doesn't want to eat that food. And this may be some of the reason why some of us are always complaining that our children do not eat food. So any food you are giving your child, you yourself, you must be able to taste it, and then you must be able to, it must have taste in your own mouth. So you just really need to make sure it is not too much, but not that you should not add at all. That is really taking it to the extreme. So from the first time and from the first day that your baby starts eating complementary food, any food that requires salt to be added, like if you are making yam porridge or something like that, you should add a little salt for it to have taste. So you should know that you should not add anything at all. But if you don't add anything at all, then it should not have taste, and the child is not going to eat it. So if you have not been giving your baby's food, I'm wondering what food you have been giving your baby for the past 6 months. I mean, because the baby is going to be 1 year and you've not been having any taste, any salt to it, that will really be, that's an extreme, So right from the first time you start making your food, you must make it to have taste. But stay away from heavily salted canned food and things like that. All right, I hope that is clear. Okay, go on.
All right. Thank you, Ma. The next one from Champagne. Ma, my daughter of 17 months always puts her hands in her vagina.
Okay, yes, you read that question.
She's not wearing a diaper.
Yes, you've
read. Normal?
Yes, you've read that question. There's nothing wrong with that. I know a lot of parents tend to freak out when their children are kind of, maybe they touch their genitals and all that, and parents begin to see it as maybe it means the child is masturbating and all that. It is perfectly normal for children to explore their genitals the same way they touch their, so they are at that phase where we call phase of exploration. They are getting to know their body parts, so they touch their face, they will touch their hands, they will put their feet in their mouth. It is perfectly normal, and that's the same way they also touch their genitals. So it is a phase of development. It is not like there's anything abnormal with the child. So you don't need to freak out as a parent. You don't need to panic. And so you should, in fact, that's the time when you should begin to now teach the child their body parts, because sexuality education is not when your child is grown up and you're now telling them don't let boys touch you or not. Sexuality education starts from 18 months. So when the children are already beginning to develop that curiosity about their body parts and they're touching it, that's the time you begin to tell them the names. You begin to use the real name. Oh, that's your penis. Oh, that's your vulva or your vagina. And you begin to tell them what you use it for. So you don't need to freak out about it at all. And then you need to let them know, okay, but when we're outside, you don't touch your private parts, you don't do that outside. You can do it when you're inside, so that the child, because the child may even want to touch other children's parts and all that. Okay, this part of your body, you don't touch another person's private parts because it's private to them. That is when we're going to teach children some of these little things about sexuality education. So it is perfectly normal and it is not an issue at all. All right, I think my moderator has run now out because of I think our network somewhere. Hopefully she will come back again. All right, I can see Emporium is asking a question. At what age should a premature baby at what age should a premature baby start to, sorry, I'm always struggling with scrolling this thing, to talk and walk? So when you say a premature baby, that's too generic. You need to be specific. So when was the baby born? How preterm was the baby born? So you need to give us that information. So usually we correct the age of preterm babies until they are 2 years old. So when they are 2 years old, we stop correcting their age. So in other words, if a child was born, let's say at 7 months, so we'll be subtracting the 2 months that the baby was born premature when we are looking at the child's developmental milestones. So for example, at 9 months, when you will say the baby is 9 months, we will say the baby is still 7 months corrected age. So but usually after 2 years, then we'll stop correcting. So you've not given us any information about exactly when preterm was this baby born, so we can't answer that question. So but then preterm or no preterm, baby should start talking by age of 1 year. So usually by age of 1 year, so for preterm baby it will be their own corrected 1 year. So they should start having 1 to 2 to 3 words. So start saying words like mommy, daddy, a familiar person name in the family. So they should have like 1 to 2, 3 words that they are familiar with. So from age of 1 year, by 2 years, they should be combining words together. So you should start combining what mommy, biscuits, mommy, go, those just 2 words like that, putting them together. That's what you expect at 2 years. So if you think this child is not talking at all, it's not saying any clear word, is not obeying single instruction. You should be able to respond to their name. You should be able to respond to things like no, stop it, that kind of thing. If you are not getting any of those responses at all, then you should know that this child may be delayed in terms of their development, and then you really need to take the child to see a developmental pediatrician. All right, thank you. I don't know why you are telling us about the formula and whatever, but the baby you're asking about development, and I don't think that really has any issue to do with what the baby is fed with. Okay, Amara Kings is asking, please, how is the ball in the testicle? Whatever. Okay, I think you're missing it up. It's actually the testicles that is the ball, and it's in the scrotum. So what you call the ball is what medical people will call testicles, and they're inside the scrotum or the scrotum bag, and they should be present at birth. So usually they should be present at birth. Some of them may be going up and down. In other words, they may be along, because usually those testes are in the abdomen when they are formed, and then they come down outside the body, because the testes have to be at a slightly lower temperature than the core temperature that we all have in our body system. So the testes are outside the internal organs, because they have to be at a lower temperature, and that is why they are stored in the scrotum outside. So usually when you grab one scrotum, you will feel the ball. They're always very moving, mobile, so you can easily, you may want to grab onto one, then you feel for the other one, and there should be two of them. So if you try to feel for the testes and you couldn't find them, usually one of the things, especially for those of you that give birth at home or in all these hospitals where they don't really have good doctors or pediatricians, it's important that a baby is examined when the baby is born, because those are some of the things the pediatricians will check for. Any baby that is born must have what we call a baby check examination. They must be examined. We count their fingers, we count their toes, we check the testes, we check all those things. So if your baby is just born and it's just congratulations, go home, they have not done the right thing. A doctor must examine your baby to make sure that everything is complete, everything is in the right places, and if there's anything, they can fix it. So if they check the testes and they are not in the scrotum, then we need to check whether they are along the line of the scrotum, because some people have what we call retracted testes, which means that the testes can go up, but it will also say come down. But some may not even come down at all, but we can check whether they're already on their way down. If they're already on their way down, the pediatric surgeon may give the baby some time to see whether it will come down. Sometimes they wait up to 1 year to see whether they will come down. But if by then they have not come down, they need to operate that child. They need to bring it down. We need to do it's not a big operation, but it's an operation that they have to bring down the testes and fix it. And this must be done within 1 year of that child's life. If it is not done, that testis is at risk of getting damaged. And we're talking about, if it is both sides, we're talking of infertility for this child, because the longer the testis stays in the abdomen, the hotter it is exposed, the hotter the temperature around it, the likelihood that it's going to get the sperms and things inside will get damaged, and the child will become infertile. And if it stay even longer, you may have it turning to become a cancer. You can have it develop into cancer. So it is always important that the testes are brought down into the scrotum. So if you don't feel, and it's something every mother can feel as well, if you don't feel your baby's testes, their balls inside the scrotum, you must see your pediatrician or the pediatric surgeon. I think next week I'm going to bring a pediatric surgeon. We're going to talk about some of these issues as well. It is very, very important. I hope this my okay, let me bring my moderator back. All right, so that's that. I hope I'm able to answer that question for Mara King. All right, so okay, welcome back. Blessing. But let me just answer the last question. I'm not really sure where you can see them. I think Amara King is asking another question. If my 1-year-old is checked, is it okay to see? Yeah, you can see actual doctor to check for you if it has never been checked. It's not too late. Welcome back. Blessing. And then Amara King is here asking, my 1-year-old, my son had cough for 1 month. We've been to hospital, azithromycin, loratadine, blah, blah, blah. but the cough is still there. So if your baby is having cough for 1 month, that's way too long. Usually most babies have cough, and it is just a viral infection. It usually lasts maximum 2 weeks. It should go. So if the cough is there for 1 month, then there's something going on, and we have to look for what is making this cough not to go away. But also be careful. Some of you also take your baby to crèches. You take your baby, to daycare centers. If you are the kind of person that does that is doing that, then it could be that your baby is just being re-exposed and getting reinfected over and over again. So you really need to watch that. So if you come on our group, I've listed a particular post where I told you all the things that you can do to prevent respiratory tract infection in children. So number one is exclusive breastfeeding. Babies that are breastfed are protected against respiratory tract infections. And even when you have started complementary feeding, the longer you breastfeed, the more protected your baby is. So breastfeeding, when we talk breastfeeding, it's not just about feeding, it's not just about food, it's about protection from all these kind of infections. Of course, immunization is key. There are some infections that be protected against by immunization. 3, you need to keep your babies away from all these fumes, smoke. Some of you cook in the kitchen and you're backing your baby. Somebody was actually asking that question, or the grandma was backing the baby and they're fleeting the house. The baby is going to have cough, obviously, because you're exposing the baby to all these fumes. Some of you, your generator is just near your window, the same room the baby is sleeping. So when you expose baby to either, or somebody, maybe your husband or somebody else in the house is smoking, when babies are exposed to all these fumes, they are likely going to have acute respiratory tract infection. So keep babies away from fumes, from kitchen fumes, frying oil or whatever, smoke, firewood smoke, or generator fumes, cigarette smoke. You need to keep babies away from them. Then also, you need to also make sure that your baby eats well, healthy food, nutritious food, fruits, vegetables. They strengthen the immune system to fight those infections. And of course, avoid overcrowding. Avoid the baby getting in contact with other people who have cough and colds. All these happy, or everybody is kissing children. It's not very good, because they are just transmitting these germs to them. So also we need to avoid that. Also daycare and crèches, you need to avoid them if possible. If you have to go to them, make sure they have this policy about keeping sick children at home or separated from other children. If not, they'll just become a vicious circle. Your child gets better, they go back to crèche, they get infected again, and it keeps on and on and on all year round. I've actually have to tell some mothers to actually just get a nanny and let your baby be at home if they kept on having so much infections. It can be that bad. So these are some of the things you can do to protect your baby. But also, a child who is having continuous cough can have another problem. So there are many organs in the body that can make a child to have chronic cough. For example, some children may have asthma, and it can present even that early. Some children can have heart disease, maybe holes in the heart, and that may be the reason why they are coughing a lot. And there are other things. So usually when the cough is going on for too long, it's not just to keep going back and keep getting drugs. It is begin to think, could there be something else? So sometimes that's the time when we begin to think, maybe we should do a chest x-ray, maybe we should do some echocardiography, look into the heart. So you really need to look for other causes of the child having that cough. So it's very, very important. All right. So before we continue on Instagram, I think I'll just quickly go to I'll go to Facebook, because I've seen so many questions for people from Facebook already, and I'll just quickly answer them. Okay, so Vicola is asking, what can I use for my baby's tummy ache? We are just 2 weeks old. So number one, when mother said my baby is having tummy ache, I always want to know, how do you know baby is having tummy ache? Because they don't talk. And some of the time we just make assumptions. Some babies just stretches and the mother thinks, oh, it's tummy ache. It doesn't have to be tummy ache. Or baby cries a lot when they are born, because that's the only way they communicate. So that does not mean baby has tummy ache. So you really need to give more information, because really a 2 weeks old, I'm not expecting baby to have any tummy ache and all that. The commonest thing babies could have at this age, maybe colic. But then even colic, we don't really give them any particular drugs or anything. It's something most babies have. It's something that resolve on their own. Sometimes we give them what's it called? Infacol, but then usually by definition of colic, baby must have been having it for 3 weeks, crying continually every day for 3 weeks. So your baby who is 2 weeks does not even qualify to have a definition of colic. So don't assume, don't always make assumption. Let's see, is there a way we can have your noise lower, or you can reduce your speaker for when, since you are not talking now, you can just make it low so that we don't get a lot of distraction.
I'll reduce it.
Thank you. So those are some of the things that we can do for now in that. So Ficola, I think you may want to see your, if you are really worried, maybe you should see your doctor for, but I don't want you to make an assumption of tummy ache. Don't make any assumption. And then Sylvia is asking, please, what could make a baby breathe deep from the sleep? That question is not very specific. Let me see, is there a way I can mute you? That question is not very specific. That question is not very specific. So what do you mean by breathe deep? Baby can breathe, baby should breathe. So you really need to give me more information. And when you're asking questions, please tell us the age of the baby and tell us more objective information about what you are asking. So there's nothing wrong with the child breathing, and I don't know what you mean by breathing deep. So if the child snoring, are you hearing certain noises or something like that, or is it breathing noisy and all that? So those are the kind of questions that you may want to ask, and that will help us be able to answer your question, Sylvia. All right. So if you are still watching me, Sylvia, just send that question all over again, and then we can see how to help you. Mayowa is asking, I have a son of 6-year-old who is not yet talking. Wow. A 6-year-old who is not talking, and it's also HBSS. I hope you are seeing that you need to say developmental pediatrician. A child should be talking from age of 1. By 2, they should be talking. By 4, a child should be able to talk to a stranger, and a stranger should be able to understand a 4-year-old talking. So if your child is not talking, I'm really, really worried about the child. So please book. I hope you all know we also run ATP clinics. You can book to see us. I'm also a developmental pediatrician anyway, or a speech therapist as well. But because your child is also is hemoglobin XS, so we really need, it's a complex case, so we really definitely need to see a pediatrician. Of course, you may also need to see a speech therapist along the line as well. So it's an urgent thing, please, Mayowa. All right. Professor is asking, good evening. Thank you for joining us, Professor. Olajumoke is saying, good evening. My 7-year-old is complaining of pain inside his head and his all since yesterday. What can I use for him? So if your baby is complaining of pain in his head, you can give him paracetamol. And if the paracetamol is not helpful, then you may want to take him to the hospital. I'm really worried about a child who is having fever and headaches. It's a very serious symptoms, and so because we really need to be sure it's not. It could, any of the other symptoms could give even malaria and other, but sometimes you need to be sure it's not something sinister like meningitis. So I would just say this child, you should take the child to the hospital, and the earlier you take the better. Okay. I think Blessing is really struggling with your background there. Let me see whether we can relieve you. I think I saw Molara online. If Molara is still available, maybe she can join me. Okay, but I can't say anymore. Okay, let's just hope we continue. Okay. Miracle is asking, can my 11-month-old wear same underpants? Okay, you see, are you saying that can my daughter of 2 years and 11 months wear the same underpants? In other words, you want them to share their underwears. If that's the question, no, please, no. There are some things you don't share with other people, and your underwears, your personal items, even your brush, your sponge, those kind of things. Each child should have their home, and they should not share them. They should learn to know these are personal effects that I use for myself. So you should not share. So if that's the question you are asking, please, that is not acceptable at all. Everybody should have their own, and you should label them, or of course, by the age, this one is for this one, this one is for that one. I try as much as possible to avoid children sharing items like that. So it's not acceptable at all. So I hope that's the question you are asking. But these are the question as I read it, that you need to stop it. You should not share. Okay, Backen Dalakwa is asking, my baby is 2.7 at birth, at 10 weeks is 4.4, she's on EBF. I want to know if she's adding weight. I think that question is, it's not a pediatric question, it's a mass. So if your baby is on 2.7 before and your baby is now 4.4, the baby is adding weight, of course, because the baby is not losing weight. So I think that is a straightforward question. If you want to know whether your baby's weight is age appropriate, then yes, the baby's weight is age appropriate. That's a better way to ask that question than to say is your baby adding weight. So if baby move from 2 to 4, that is addition. So that's very straightforward. Okay, thank you. If your mom is asking, my mom told me to buy Abidec, Pecan, immediately my baby clock weeks. Which weeks? You didn't tell us which weeks. My baby is 2 months old. I hope it is safe. No, it is not. Please don't buy drugs for your baby. Your baby don't need no Pecan. Your baby don't need no Abidec, nothing. Your baby just need for you to breastfeed exclusively. So we don't recommend that you give children we don't recommend that you give the children breast milk. Blessing, you know what? Just put your phone, put your speaker down to the lowest. You know, then when you are ready to speak, you can put it out because the noise is distracting me. I'm sorry. It's so much.
Is it better now?
No, it's still loud. It's loud.
Is it better now?
Okay, I think so. Yeah.
Is it okay now?
Yeah, I think so. Thank you. Okay. So if Mama is asking that my mom told me to buy Abidec and Pecan immediately my baby clock. You didn't say how many weeks, but your baby don't need for you to buy any medication as long as your baby just needs for you to be on breast milk. We don't recommend that you give your children tissy mixtures, which is what Pecan is. Your baby do not need anything. They do not need any medication. All you need to do is to give them breast milk and your baby is fine. You know, so don't follow that advice. I know I know there's a lot of rancor between mothers, mother-in-laws, and mom of new babies. And I know that you are always in a fix in between what to do or what not to do. But just let me let you know that as far as pediatricians are concerned, we have only one baby, only one mother. Even though I know that in Nigeria we have so many mothers, but as far as the pediatrician is concerned, we have just one mother, and that is you. You are the one that take responsibility for your child. So please feel free to stand up to say, I don't want this, I don't want that, you know. And don't I know it's going to be a lot of struggle with the grandparents because they believe that they know best. But you can just tell them that that's what the doctors say, that's what the pediatricians say. My pediatrician say I should not give this to my baby. That's okay, it's okay. Just put it on the pediatricians. And if you are struggling, you can take your mom with you when next you go for your clinic with the pediatricians and with the doctors, and let the doctors also tell the mother to their face so that this is it. So even as a pediatrician, my mom will tell me when she comes to help my baby, like at least I said, no, I'm not doing this, I'm not doing that. So of course she has to let it go because it's my baby after all. So as long as, you know, I'm not saying you should be disrespectful, I'm not saying you should fight anybody, but you really need to make sure that you you apply your wisdom. And please, when it comes to your baby, it's your responsibility. I can tell you guys a lot of stories. At the end of this, they are just going to tell you sorry, but you are the one that will know that you have just wasted your 9 months. So please don't even let anybody dictate to you when it comes to your baby. Your baby is your baby. You take the final decision, you and your husband. So please be very firm, but at the same time we can be very polite when it comes to your baby. All right. Okay. All right, I think we'll come back to Instagram now, but let me just answer one or more question. Okay, so first one is asking, my baby have rashes. I think it's itch rashes. It appears red in color. I can't tell you what rashes it is without seeing it, because rashes have to be seen. And usually each rashes are not red in color. Usually each rashes are not red in color. Sometimes they can appear a little bit reddish, but usually they tend to look more like there's something with a little water inside, like like if it's sweat that has collected and turned into like a little rash. That's how it dries. So what I would advise you is that if you really want us to answer that question, then you may want to take your baby to, you may want to put a picture showing that rash for us to say, then we can advise you appropriately. But right now, without seeing a rash, we cannot tell you what kind of a rash it is. And I know it's a little bit frustrating, but that's just the way it is. And I know one thing I always tell Nigerian mothers, some of us, we overwrap our baby too much. In Nigeria, we live in an environment that's already hot. But I don't know why mothers, we believe that we must always put the cap on the baby. You must always wear socks. You must always wear gloves or mittens for them. Most of the time, bless you, I think I will just let you go. You are really sorry. I'm sorry, but the noise is too much. I think I just have to let you go. Sorry. Is there no way you can get somebody a better, quieter environment?
I can hear you now, Mike. Yeah, thank you for me.
Okay, let's wait a little bit. Okay, so what I was trying to say is that the reason why most of the newborns have rashes, there are two major things. Number one is either you are over covering them too much. Like if you are living in a hot environment, then there's really no reason for you to wear cap and socks and main things for newborn babies, and then wrap them, then you wear them thick clothes, then you wrap them again, and the babies are sweating so much and all that. There's really no reason why that should be happening. So because of that, that is why these babies tend to have these rashes a lot. So please make sure you dress your baby according to the weather. Wear light. If the weather is hot, wear light cotton wears. Please let your windows be open. Let there be ventilation in the house. The child does not have to be so hot as if they are being because I know mothers are being scared of maybe the hair must not breathe on them, they will catch infection. No, they are not catching infection from the hair. They are catching infection from people that are coughing and sneezing, when you don't wash your hands, when you don't breastfeed. So it is not the heat. They need, of course, they should not be cold, but then they should not be hot as well. Then another reason why babies tend to have rashes is also the products you are using on the skin. So always go for what we call hypoallergenic products that don't have too much chemicals in them. The more natural they have, the better for the skin of your baby. And baby don't need for you to be applying powder on their skin and all those things. Even some people say they're using baby perfume. Some of those things, you are just introducing those babies to rashes. So you really need to move away from them, and then your baby will be fine. Okay, so let's go back to Instagram now, and then we can take some of the questions on Instagram. Okay, go ahead.
Okay. This is coming from Sharon. Please, ma, my 10 weeks old baby has been pooing greenish poo for some days now. She's on EBF and she weighs 6.8 as at today. Birth weight was 4.5 kg.
How old is the baby?
10 weeks. 10 weeks.
So greenish poo in babies usually is due to inadequate feeding. That's the commonest reason why babies on EBF we have greenish stool. So please make sure you breastfeed exclusively and frequently. And when you're breastfeeding, please make sure the baby empties the one breast before you switch on to the another. So because the first part of the breast is usually the first part of the breast milk, what we call the fore milk, is usually watery, and then it doesn't have much milk. It doesn't have much of the fat inside. It is the last part of the milk that is creamy and that has so much fats, and that's the one that actually contains a lot of the calories. So the initial part is to satisfy the taste of the baby, but the last part is to fill up the baby with the real nutrients, and so that the baby will be full. So please, it's important that you don't quickly breastfeed 1-2 minutes and you jump away to another breast. You are going to end up giving only the full milk. So you need to make sure the baby empties the breast. And most mothers, when your breast is empty, you will feel it. You will feel that breast go down flat. Then you will now, if the baby is still not satisfied, we can switch on to the next breast. And your baby should be breastfeeding at least something less than every 3 hours, you know. So you make sure your baby empties the breast. So it's very important that you do that. So another reason why baby could also have issues could be if you are giving medication, or if you are also taking some products, like some products that have some flavor of certain things that can color the stool of the baby if they pass on via the breast milk. But otherwise, the common reason is actually due to that inadequate feeding. So make sure you breastfeed frequently and make sure the breasts are emptied each time. All right, let's go on.
The next question seems like a continuation from Intel Blog. She's saying, are you referring to hernia surgery?
No, it's not hernia surgery. I know you are asking about is it the testes coming down? It's not hernia surgery. It's not hernia surgery is different, but you don't worry about the name of the surgery. But if the baby's testes are not down, they have to be brought down, and that's the way. That is the way they have to be brought down. You don't worry about the name. I usually don't bother you with the jargons. What is called is not important. The important is what is done. What is done is that the testes have to be brought down and fixed into the scrotum.
Okay. The next question is coming from Saini. My 9-month-old baby has not cut a tooth yet. Should I be worried?
No, you don't need to be worried. You don't need to be worried. It's okay. Some babies don't cut their first tooth until they are 1 year old, so that's perfectly normal. So you don't need to worry at all. Okay, I think I've lost. Okay, are you back? Go on.
All right. The next from Pet Perfect. Hello, good evening. My 23-month-old son is not making clear words. He obeys commands and responds to his name. He only talks in the baby language. Should I be worried, please?
Yes, you should definitely see a speech therapist and with a developmental pediatrician, because a almost 2-year-old should have at least be combining 2 words together. Yeah, so definitely you need to see one of us.
Okay. The next one from Modupe. My 3-month baby farts a lot. Is it normal?
Yeah, it depends on what you are giving the baby. If the baby is on exclusive breastfeeding, they can do that as well. So there's no issues with that.
Okay. The next from Cute Steppers. My 1-year-old baby has not started crawling, walking, and talks too in baby language, and took him to a pediatrician at FMC. They directed us to see a physiotherapist, but I have not seen changes yet.
Yeah, okay, at least you've seen a physiotherapist, so at least they've started something. So the changes is not going to be immediately, but did the doctor tell you why your baby has those delays? So I think that's the aspect that I didn't understand. I have a feeling they must have told you that, because it's not just enough for us to tell you to go and see the physiotherapist and all that, but we must be able to tell you why is your child having that delay. I think that's the more question you should do, and you may need to see your you must need to see your pediatrician and ask those questions. Why is my child delayed? What are the likelihood of what is going to happen, because so that you will know what to expect and all that. So that's very important.
Sorry, the next question is from Amara Kings again. She said,
Okay.
Please, ma, what's the ideal age to start potty training?
Potty training from 18 months. Age. From 18 months. From 18 months.
Okay, the next question is from Yemi. He said, Good evening. Please, whenever my 5-month son changes environment, he always has burnt skin reactions around the neck and back. when it changes environment.
It may be somebody who has a sensitive skin, and if the child has a sensitive skin, the most important thing is to know what it is that the child is allergic to and avoid it. So that will be helpful. So if you know what the child is allergic to, I think your child, I don't think it's just about changing the environment. Of course, those are the triggers, but looks to me like it's a child who already has an underlying what's it called, underlying maybe atopic dermatitis, like an allergic skin condition. And so that's change environment is just the trigger that brings this out. So yes, so but your child is child who already has like either an allergic skin condition or a sensitive skin condition. So you now need to know that, and you need to take all the precautions how to avoid those scenarios. Yes.
Okay, thank you, ma. Should I still continue? The next question is from Udochi. Good day, doctor. My baby will be 9 months on the 15th. No teeth, and she isn't crawling. Should I be worried?
I think
a friend said I should get her some certain nutrients to help for the teeth and crawling.
No, there's no reason to worry about the teething. Crawling, usually most babies start to crawl at 9 months, and some babies also never crawl. So it is a little bit neither here nor there. I'm not going to be worried anyway, but is your baby able to sit by herself, with a straight back? If the baby is able to sit, then I will not worry, because some babies never crawl. So maybe we do what we call bottom shuffling. In other words, they move with their bums, not with the they don't crawl, the typical crawling. But if your baby's other developments are fine, your baby is sitting straight without any support and all that, then I would not worry about your baby. Yes, at least for us to worry about crawling, it will be after the baby is like 1 year. So we'll give the baby some time to see, because not everybody do everything on the 9 months. Some people a little bit earlier, some people a little bit later. So that's the most important thing, that all the other area of development are fine. And like I said earlier, some babies don't cut the tooth on the first tooth until 1 year. So there's really no reason to worry about. But usually when baby is 1 year and your baby doesn't have any teeth yet, you should see the dentist. And if your baby is not yet crawling by 1 year, you should see the pediatrician.
All right, thank you, ma. The next question is from Sini. My baby started walking when she was 6 months.
Now that's pretty early.
Now she's 9 months, and I see signs of bow legs. Should I give her any supplement to help straighten the legs?
No, there's no need for any supplement. You don't just go and give anything unless if doctors recommend things. So there's some level of bow leg that is actually normal. It is normal for a baby to have that. It's what we call physiological. As they grow older, then their leg stretches out, and there's really no need to worry. But if you think the child has significantly bow leg, like it's so obvious and you're worried, then you need to see the pediatrician, and then the pediatrician will now there are tests we do for us to say, okay, maybe a child has rickets, for example, and we will now decide whether does the child need calcium, does the child need this. Don't just go and be giving your children any supplement. Some of you will just go and be giving your children calcium. Calcium can cause constipation, it can cause kidney stones, it can cause so many things. So please avoid giving things that have not been recommended by the pediatrician. So we have where we test those things, and when we test them, if it is low, then we now need to know what quantity we're going to give your child. So, but just if it's just a minor bow leg, there's really no reason for you to worry. Just leave it alone. But if you are worried, you can also see the pediatrician, because the pediatrician can now tell you, okay, this is a minor one, nothing to worry about, or I am worried about maybe rickets or something, and I want to do some tests, and then I will recommend treatment. But don't just go and be using treatment or drugs or anything on your own. It's better to stay away, because there's no drug that cannot cause side effects. So be aware of that.
All right, thank you, ma'am. This is coming from Lady. She's saying, well done, ma'am. Please, is it good for a baby of 3.5 years to take chilled water once in a while during hot weather?
What is chilled water?
Like Chilled, like very high cold water.
Oh,
She was
shield.
chilled.
Okay, shield.
Yes,
Okay, I was
chilled
wondering whether
water,
that's
very
a
cold.
trade name.
Yeah,
Sorry.
very cold water.
Oh, yeah, why not? They can, but we don't. But it's better to stay away from that because of their teeth. You can give them normal water. You can give them even slightly cold water, but not like very ice cold. You know the one that you yourself, when you take it, your teeth will be shattering. You don't want to give children those kind of teeth. I mean, those kind of very too ice cold water. But they can take, you know, you know moderately cold water. There's no problem with that. Yeah, they can. The child can take the water that they can handle. But you know what I mean, because some of you, there's those kind of cold water that you yourself as an adult, you can't easily just swallow it like that. So they can take those one. They can take the one that they can handle. So we better mix it with normal water so it's not so bad.
The next one, Titi Lola is saying, my baby of
Mm.
6 weeks, hiccups and farts a lot.
I think we've answered that question.
Hiccups.
Hiccups is
Yes,
fine.
we've answered the question.
There's no need to worry about hiccups. It's a minor issue in babies. There's nothing you can do. It stops on its own. Just leave it. You don't need to do anything about it, and it's not something to worry about. So it will start and stop on its own, and that's it.
Okay. Kosi is asking like 2 questions at a time. She's saying, hello, my baby is 6 months. She often runs temperature. I took her to the hospital and they gave antibiotics. Also, she has running nose with catarrh. Is it a sign of teething? Then when should I deworm my baby?
Okay, so one, fever, running nose, cough is not sign of teething. And can we just once and for all take teething out of that equation? I don't understand why everybody is always asking whether whether it's a sign of teething, and how does that even solve the child's problem? Because you are still going to the hospital anyway. So if you saying that it's teething, does that mean that the child should continue to have fever and cough and catarrh? Or is it because you think that means that you should go and give a teething medication? Because giving teething medication, we don't record. There's even nothing called teething medication. So all those drugs that they pack together and they sell to you as teething mixtures, what are inside? Go and read them. What they've added is that they've added paracetamol and they've added maybe Phenergan. They just mixed up some cocktail of drugs, so paracetamol to take care of fever and Phenergan or something like that to make your baby sleep. That is what they sell together for you as pecan or baby rex and all that. That's what is inside them. But the problem with that is that they are giving them in suboptimal doses. Two, you are giving all those pecan or baby rex, and then you will still go and give paracetamol again, for the fever, and then you don't know that you are damaging your baby's liver. So that is why we tell you there's nothing like teething drugs. There's no medication for teething. Teething is not a disease. It does not make a child to have fever. It does not make them to have catarrh. It does not make them to have cough. It does not make them to have diarrhea. It does not cause any illness whatsoever. So please stop asking if anything is a sign of teething. If anything is a sign of teething. Even some of you now, when your children have had all their teeth, then you will now be looking again for what do you want to blame now? Okay, your children have all the 20 teeth. And so what else are you going to blame the fever and the cough and the catarrh or the diarrhea on? So it is not about teething. So let's just even take that teething out of that equation completely. If your child is sick, you need to take your child to the hospital. You need to know why is this child sick. Some children don't come to hospital on time because this mother, you think is teething, and then you'll be giving all those your teething mixtures, and then the child is dying. And then when the child comes to the hospital, there's this one nothing we can do. These are things we have seen. These are things that when you ask mother, mom, this child has been sick for 2 days, 3 days. Why have you not come to the hospital? Oh, they say it's teething. No, they say it's teething. I should be giving teething drugs. And that's why the child comes so late to the hospital. So please, it's very important that you don't assume teething ever in a child who is sick. If a child is sick, please bring that child to the hospital. Let the doctor see your child and let the doctor know why your child is sick. The child bringing out teeth should not make the child sick. So the same way the child crawling, the child walking, they don't make them ill. So the child bringing out teeth should not make them sick. So if your child is sick, this child is having respiratory tract infection. That's what I can tell you. Your baby is having fever, is having cough, is having catarrh. That's respiratory tract infection. And you've been to the hospital and your doctor already treated your child, so that's fine. So why you are still asking why it's a sign of teething, I don't know. Maybe because somebody wants to sell you teething drugs. Please do not give it to your child at all. Don't give any of those dangerous drugs to your children. So stay away from them. Just do what your doctor have asked you to do, and that's okay.
She asked another question. When should I deworm my baby?
Okay, your child should be dewormed at age of 1 year. 1 year. I know some of you go to these health centers where they start giving you medication for deworming at 6 months. Some of them give you as early as 9 months, but we usually pediatricians, we don't recommend this. So you really need to understand that there are level of authority when it comes to the care of children, and so we as pediatricians, we don't recommend that. And for if you go to our Facebook group, I've put there what the World Health Organization recommends, even for a country like Nigeria. I think the reason why maybe some health centers are doing it is that maybe they are afraid that maybe you may not come at 1 year, so they just want to catch you early or something. But it's really not necessary, and logically, it's not necessary. Why are we deworming children? So before 6 months, babies are on breast milk. They are at home. They are with you, so they are not taking any external thing. So where are they going to get the worms from? They are not likely going to get worms. So babies are exposed to worms when they start to crawl, they start to touch dirty surfaces, they start to eat other food that may have been contaminated with worms and all that. So that is why we tend to move it towards the age of 1 year. And so your children do not need to be dewormed until 1 year. So all this giving worm medication at 6 months is really not necessary. I mean, it's not as if it's going to do any harm to your child, but just a waste of medication, in my own opinion. So the World Health Organization recommends that you deworm from age of 1 year. Yeah. Blessing, is there somebody with your child? Is there somebody helping you with them?
If somebody's with him or they just want to be with me, but they are in another room.
Okay, sorry about that.
Okay, sorry, ma. The next question, the age is not well stated. Said, please, what makes a 3.5-year-old baby syringe to be yellow? So I don't know if it's months, weeks, or years. So I'm not sure if we can attend to that question.
Anyway, I get a lot of all these questions about urine being yellow. And the first thing I always ask parents is, number one, if it's a child above 6 months, the child drinking enough water. And then when did you see the urine yellow? Is it when the child has passed the urine, or is it the urine that has collected in the diaper for many hours or something before you change? Because urine will change color depending on how long it has stayed before it is looked at. So dehydration or urine staying long. Yellow urine does not mean your child has malaria, which is what many people always think about. It does not mean your child has malaria. It does not mean your child has yellow fever or anything like that. So please stop assuming, oh, my baby has yellow urine, that means child has malaria. Or my child has yellow urine, that means my child has what's it called, yellow fever. It's nonsense. Your child urine can be dark colored or may look a little bit yellowish to you if they are concentrated. In other words, the child has not been drinking enough water, or it may be as a sign it's the fact that the urine has stayed for too long as at the time you are looking at it. So I stopped diagnosing malaria by urine color or diagnosing any condition. That's not how we diagnose malaria. This is by blood test.
All right, thank you, ma'am. The next question is from Chief Girl. Please, do I need to worry if my 2-year-old daughter touches my breast before she falls asleep?
No, it's just an habit. It's just an habit. Some children like that. It's just their own way of comforting themselves and all that. If you think it's an habit, you don't want the child to continue, it's fine. You can stop it and try to get your child to fall asleep without necessarily needing you. So the days you are not at home, what will happen? So you just need to let the child start to fall asleep without you. So there are many ways to do that. So you can let the child be in their own bed, have a sleep hygiene routine, let them be already in their bed, reading books and all that. There are many ways around that. So you can just replace it. Instead of touching your breast, you can give it maybe a dolly or something else to touch. You have to do it in a gradual way, and then the child can get out of that habit. Even if you don't do that, most children after a while, they also know that it's inappropriate and they just stop on their own. But if you want to stop it earlier, find something else as a replacement for the child to cuddle with and all that before they go to sleep. So that's okay. It's a normal behavior, it's a normal habit. There's nothing to worry about. Okay.
Okay, the next question
Should we go
is
to
blocked nose.
Okay, yeah, after this one we go to Facebook. Yeah.
Facebook. All right. Say, please, my baby has blocked nose. What can I do to ease it?
So when you're asking questions, please always tell us the age of your baby. It's very, very important that we know which age are we talking about. So, but usually I would just say you can put like saline drops. There's normal saline drop. It is not ultravenous. Most of you will go to the all this pharmacy shop and they don't have normal saline nasal drop, and they will now give you ultravenous. No, it is not ultravenous. Please don't give the ultravenous to your children. Don't use it. As for normal saline nasal drops, you can use it. It helps to soften the mucus and it can go out. And if you think it's not going out, then please see your doctor and so that they can do further evaluation. Okay, so let me just quickly go to Facebook and then we can take some of the questions on Facebook. Yeah, I think I've answered that one. Okay, so Sylvia is saying Alliance cough and catarrh are viral and will resolve on their own. So how long should we wait for them to resolve before going to the hospital? 2 weeks. So most of you, when you read us or when you are quoting us, we always are very detailed. We know what we're saying. So we always are detailed. But some of you start to read the beginning, you don't read the end. In this same place where you've read about cough and catarrh are viral, we also have information there about when do you go to the hospital. So we say usually they resolve within 2 weeks. But what are the signs you should watch out for? You don't even have to wait to 2 weeks before you go to hospital. If your child is having fever, if the child is having difficulty with breathing, if the child is breathing fast or the child is breathing, with difficulties, you have to take the child to the hospital. And that's the way you wrote it is not even absolutely correct. We don't say cough and catarrh are always viral. We say most cough and catarrh in newborn babies and young infants. See, every word, whenever we write things, every word has an implication. So we're talking of newborn babies, we are talking of very young children. Most of them are due to viral infection, not all of them. But the ones that are not due to viral infection, they tend to come with fever, very high fever. They tend to come with fast breathing, difficulty with breathing. So those ones you will need to go to the hospital for. So please, when you are reading our comments, read everything, understand everything, because we are also very careful when we are giving advice. We don't just give a blanket advice. We always tell you, for example, for ORS, give ORS and diarrhea, but we also tell you when to go to the hospital. So if the child is vomiting, the child is not keeping down the ORS, the child is still getting very dehydrated, is always asking for water, the child is becoming very weak. So we give you all those signs that will tell you that this is no longer home treatment. This is now hospital treatment. So please always read us to the end. So I always see people quoting ATP, but I see you missing out some of those key elements that we also put in there as well. Thank you so much. Okay, Barry Suka is saying my 1 year 4 month old breathing is like pressured. It just sinks in. Yeah, I like your description. It just sinks in and out when breathing, and it's really scary. He has been nebulized before. We were had to repeat it again. My question is, how long will it take for his breathing to return to normal? So I didn't hear you telling me you've been to the hospital, but I assume you've been there. If your child has been nebulized, you really need to go to the hospital. Your doctor needs to tell you, please, when you go to hospital, don't just take treatment. Ask them what is wrong. Let the doctor tell you what is the diagnosis. So, for example, maybe your baby has bronchiolitis or whatever, I don't know. They should be able to tell you what it is so that you will be able to know what to expect. And the doctor, because once they tell you what it is, then it will help you to know how long it's going to last, when is it going to resolve, and the treatment that the child needs. And if your child is not better, of course, you should always go back to the hospital. There's always a room for what we call follow-up. So there's follow-up review. So this child that is breathing and is still breathing very with difficulty should be in the hospital. Sometimes we have to admit them until the breathing is better. So if you are still having a scary moment at home because of the way the child is breathing, then you really need to take the child to the hospital and let the pediatrician take it up from there, because we are worried about the child's breathing. I can't tell you how long is it going to take to return to normal, because I don't even know what's the diagnosis of your child. I don't know what is being treated. I don't know what has been done. Is the treatment working? Is it making progress or not? So if we don't have all those information, then I can't just tell you like a magician. Some of you think we have so much superpower. We don't have so much superpower. The way we can give you information is based on what you tell me, as especially when I'm not seeing the child in front of me. So I can't by any superpower told you when it's going to go back to normal, because I just know that your child has something that has to do with breathing. I don't even know what is causing it, because a child will have breathing difficulties due to so many things. It may even not just be a respiratory problem, it may be a heart problem, it may be so many things. So, but I'm happy you've been to a hospital, because nebulization sounds like you've been to the hospital. If your child is not better, please go back and let them take it up from there. All right. Thank you, Barisuka. Next person. Olachimoke saying, I'm a lady of 30 years. I always have pain in my hips for the past 2 months. I don't see my period. I felt I'm pregnant, but I don't feel like that again. And I did the test. I said positive and negative. I'm confused. I think I'm also confused as well. So I think, Olachimoke, your case is not something we can answer online. I'd rather you just see a doctor, preferably a gynecologist, so that they can examine you properly. There are many ways we can confirm pregnancy apart from the urine test. So we can do blood tests, we can do scan, and so we can do so many things. So some of those tests you do, some of them we call them false positive. In other words, you could look as if you test positive, but you're actually negative. So that's not unusual. So, but you really need to see your gynecologist, and then they can take it up from there. Okay. All right. So Shakira is saying, Doctor, good evening, ma. I posted 9 months ago when I put to bed, complaining about the swelling in my baby's left breast. You said it's an accumulation of milk due to vascular hormone, but my baby is 9 months old now, and that swelling is there. Please, I'm worried what you need to do. We have never pressed it. Thank you for not doing that. We have left it just as you're interested. Thank you. Just still leave it alone. It may take several months, in fact, sometimes up to years, for you to go back to normal in some babies. Just leave it alone. Don't worry about it. I know it may look to you like there's something to worry about. It varies from one child to another child. Some children don't go down quickly. Some children don't take several months. So you don't need to worry about it. And if you're worried, you can go see a pediatrician again if they want to look at it. But I can just reassure you that most of the time we'll just reassure you again and tell you to just leave it alone, and it will clear by itself. All right. Thank you. Zoe, come on, sure. Zoe is saying, my baby of 15 months, I've been purging since yesterday. Very offensive, watery, funny looking, particles, 6 diapers, and his body is really hot. Okay, good. I took him to the hospital. They've done the test, but I have to give some medication, and the temperature is still high. I guess you went to the hospital this morning. Okay, so if you have been to the hospital this morning, please give medication time to work. I don't know why mothers always ask me this question. Okay, number one, when the baby is sick, the sickness did not start in one day. It's not going to go in one day. So you've got to be patient. You've been to the hospital this morning. That is barely 12 hours ago. So you have barely, I'm sure you've given only maybe the first set of the doses of the medication. Just give it time. So if the body is still hot, you can give the baby a cool bath. You can give paracetamol. The paracetamol can be given every 6 hours. So if it has been over 6 hours, you give the last one. You can repeat the paracetamol. So don't be in a hurry. Give the medication time to work. So, okay, so there's no magic. Pediatricians, we are not magicians. So when you go to the hospital, you start medication, it's not going to disappear. I wish we can just wave a wand over the baby and everything just disappear in 1 minute. It's not going to happen. It's going to take days for those things to go back. So don't be panicky. I'm happy you've been to the hospital, you've done the test, the doctors are giving you medication, and so you started the medication. Continue with the medication. Be patient. I will usually say use the medication for at least 48 to 72 hours before you even begin to disturb us again to say this thing is not working. You have to use it for 48 to 72 hours. So it is after that, if you think baby is not making progress, then you should go back to the hospital. Or maybe you are using a medication, the child is not taking a medication, the child is vomiting, and then you can go back to the hospital so that they can admit the child and give the child intravenous medication. So that will be a better option. But please be patient. She just went to the hospital this morning, so in my calculation that may be maybe less than 12 hours ago. So you still need to give it some time to work. All right, I know it can be very frustrating, I understand that, but also know that the medication has to be absorbed into the body. They need to go to where the issue is. They need to work. And that is why the doctor did not give you medication for one dose. They give you medication to last 3, 4, 5 days because they know it's going to take that long for the whole thing to clear. So you are just started. So don't be in a hurry. It will go. All right. So just keep giving. But make sure the child is not getting dehydrated. Make sure the child is taking the ORS. If the W is hot, give the paracetamol, and that'll be fine. All right, somebody is saying, can an 8-month-old drink Ribena and Hollandia? 8-month-old cannot drink Ribena. Sorry, I'm not breaking anybody's market, but usually those drinks should be from after 1 year. Before the age of 1 year, all that I want you to give your baby is water and milk. You can give fruits if you make fruit, if you squeeze out the fruits yourself, but not the one they sell in the store. So before 1 year, all we want baby to take is water and milk. That's the only beverage an 8-month-old can take. The baby can take yogurt. Yogurt is like a derivative of dairy, it's like milk as well. So that's fine. All right, let's move on quickly. Our time is running. Wow, our time is gone actually. Okay, but I'll try and finish the one I've asked. Okay, Kali Bright. My 3-year-old has blood stain in the wipes that I used to clean its anus, and it comes and go. What should I do? This too is normally hard. That is why the baby has constipation, and I guess the constipation has caused some tears or some ulcer in the anus. So number one, we need to make this too soft. So you need to see your pediatrician. There are medication that we can give you. Number one, make sure baby take a lot of water. Make sure the child takes a lot of fruits, and then make sure the child takes a lot of water and a lot of fruits, and then the baby can have softer stools, or sometimes we even have to give some like what we call stool softener, lactulose, and other. There are different type of them. We may need to give that, but you also need to see the doctor because we need to look into the anus as well to know whether whatever the tear is and all that we can deal with it as well. So you may need to see your doctor to sort it out. It's very urgent. All right. Let me just finish answering all my Facebook thing, then we can now wrap it up. Jennifer is saying, my baby with 10 months cries during meal times. I have to hold him tight so he doesn't knock away the spoon, blah, blah, blah. Is this force feeding? I think you have asked this question before if you're not the one anyway, but it's not force feeding, but we don't want you to be holding the baby tight when feeding. We want you to make meal times pleasurable. So I will encourage you to go to our Facebook group, go and do our guide 2 course on complementary feeding. Watch the videos. We have lovely videos on how to go about feeding your baby. It's very nice for you to watch, and you can learn some tips for that. So that feeding should be interesting, should be fun. It should not be fights or wartime. And thank you. Jennifer is saying, what made the scrotum to shrink and later come back to normal? So I guess your baby's testis is going up and down. That's what I can think is going on, but there's no reason for you to worry. My baby is 7 years. I think I've answered your question, I've answered your question. I've told you your baby needs to go to the hospital, and yes, and I think this person asking about hip pain. I've told you have to see your doctors as well. I guess I've answered your question. Miriam is saying, my baby of 1 year, 8 months, do have high temperature Is it every month you meant to say, I have taken him to the hospital, the doctor says white blood cell is high. After giving him drugs, it will recall again. What will I do, doctor? So if your baby white blood cell is high, that means your baby is having infection. And if your baby is having it every month, the question we need to ask ourselves is, why is your baby having infection every month? So you really need to see a pediatrician. I don't believe in you just going to the doctor and they just keep giving you antibiotics every month. You need to see them and have a conversation. There are other tests that doctors can do to know why your baby is having infection. There are many questions we need to ask you about your home environment. Is your baby going to crash? Is your baby in a daycare? Who is taking care of the baby? What's the hygiene like? What are those things? Because sometimes if there are some things at home or that you are not dealing with, then your baby will keep having those infections. So we need to sort those ones out first instead of just giving the baby treatment all the time. We need to go to the roots of the reason why your baby is having recurrent infections and sort that one out quickly. Okay, so I'll just quickly round off. Okay. Francisca is saying my baby is 1 year 5 months. I noticed her right breast is bigger than the left, but she doesn't have pain. There's no reason to worry about it at all the breasts are never exactly the same size, so no reason to worry. Adaku is saying my baby is 1 year 7 months, not eating solid. Yeah, why is your baby not eating solid? You are the one not giving your baby solid. Your baby should be eating solid. Your 1 year 7 months old should be eating everything you are eating in the family. Should be eating from your pots. So if your baby is not eating, you are the ones that I'm going to put the blame at your footsteps. But not to worry, you can still learn how to feed. So if you go to our Facebook group, go to the guide section, go to guide 2 on complementary feeding. There are feeding videos, there are articles to help you through this, there are tips, lots of tips, even on our Instagram page, lots of tips as well. Please go through them and start to give your baby solids. We need to get complementary feeding right. Most of you are very comfortable giving all these cereals from the teens, and then you keep giving it even 1 year 2 years. That's why one day you now wake up, the child doesn't want to take solid because you've been feeding, you've never introduced it to them at the right time. All these things should have been introduced right from the time you are starting complementary food. You start from semi-solid porridge, and then as they grow older, by 9 months, you are making the textures more solid, grittier. You are giving them finger foods and all that. By 1 year, they should be on family food. So the earlier we start these things, the better. So, but it's never too late to learn. Okay, can a 1 year old take tea, Milo, milk? Yes, yes, yes. But make sure the child is eating other food. Those things are beverages. They are not the main food. Don't feed their tummy with so much beverage that they don't have time to. There's no space for real food, or they want to eat. They want to take beverage morning, afternoon, and night. That is not appropriate. So it should not be more than once or twice a day. In fact, once is better. So let them eat other food and let them take milk as well. Okay. Is it normal for one side of the scrotum to have one ball and the other have two? The other side doesn't have two. The other has only one. You are the one that is feeling like you think you have two. It's not possible. The baby can only have 2 testes. So, but sometimes when you are moving from one side, it will be, they shift a lot. So you may be feeling the second one and think it's the two. It's not possible. So, but if you are not sure, let a doctor do the examination. Adeshimoke is saying, my 2-year-old baby, my 2-year-old still babbles, does not say any words. He also stopped certain simple things he has been doing before. I am worried. I am also worried. Usually when a baby regrets, no matter what, there are things they are doing before and they stop doing it, we worry so much about autism spectrum disorder. And the child who is also not talking, a 2-year-old should be talking. 2-year-old should be combining 2 words together. So you really need to see a developmental pediatrician and a speech therapist for further assessment in your baby. The earlier, the better. Grace Favor is saying, my baby is 1 year, 3 months, but has not started walking. Okay, and it works when he goes something. Okay, it looks like his leg won't carry him, but it looks bending. He hardly eats solid food. So usually, we will say until 18 months before we worry. But you're also saying something about the legs is not carrying him. So I'm worried about, is there other signs your baby is having, like is the leg weak or something? So if your baby also has other signs, In other words, even if your baby is 15 months and not yet walking, but the baby should be able to stand and should be able to move around, holding to support. But if your baby is not doing any of those ones, then maybe you may want to see a pediatrician early. But normally, I would have said if there's no other sign, wait until 18 months, and then your baby should be eating solid food. There's no reason. Well, people say my baby not eating solid food. You need to introduce it to them early. So you can go through our complimentary feeding course, and then you can get that information there. All right. Before the last question, your baby is having catarrh. It's just 1 month. Don't use anything. Just breastfeed the baby exclusively. Keep the baby warm. Keep the baby away from people that have cough and catarrh as well. All right. And then last question. What medicine is best for deworming? There are lots of them. There's albendazole. There's combantrin. There's what's it called? There are so many of them. Just go to the pharmacy. They will give you any one for deworming. Just buy the one that is age appropriate. I usually recommend albendazole. Is the most readily available. All right, we finished. Do we still have any pending questions on Instagram? Then, or we can just close now.
Yes, I lost connection at a point, so I lost some, but I just have like 2.
Okay, let's just take those 2. Sorry if you missed your question. Yes. Oh, let me see whether I can figure it out. Well, if we miss your question, okay. Did you answer the question about biscuits and all that?
No.
Okay, and you stop at block nose, Sabi.
How old can we stop breastfeeding?
Yeah, breastfeeding is 2 years. 2 years to stop breastfeeding. Is it okay for babies to take vitamin C and key supplements on a daily basis? It's really not necessary. It's better your baby eats real food. Take fruits and vegetables, then you don't really need all these supplements. But if you think your babies are not taking fruits and vegetables and they are not getting enough vitamins from the food they are eating, then you can give it. And the dose is always according to the age, and it's always written on the bottle itself. At what month can a child eat biscuits? Please stay away from junk food. Instead of giving biscuits, give fruits. Usually children start taking finger food by 9 months. So from 9 months, they can hold something and eat it. But we prefer you give them healthy snacks. Give them like a fruit, banana. Give them something like boiled egg, okra, those kind of things. Let them eat on that, not the biscuits. Biscuits occasionally. When you start them on this junk food, then they don't want to eat normal food. So stay away from them. All right, I've answered the question about blocked nose. We've answered the question on blocked nose. We don't recommend pacifiers. Because pacifiers, number one, the children sucking a lot of hair, and this hair make them to be gassy, and then they tend to drop on the floor, and then they tend to catch germs. Then it can also cause nipple confusion. If your baby is not yet sucking well on the breast and you introduce pacifier, then they may want to actually suck on the pacifier rather than suck on the breast. So personally, I don't recommend pacifier. I know there are schools of thought, different schools of thought, but I don't recommend that. Some people say it's fine, but I don't recommend it. 42 months old, take chilled water. I think we've answered this one now. We've answered the chilled water one. And
yes, we answered chilled water.
Eye discharge coming out of 15 months old with little redness. What's the cause? Most likely it's eye infection, conjunctivitis, and you really need to see your doctor to please don't go and buy gentamicin eye drop. Don't go and buy chloramphenicol eye drop, because there are now restrictions about use of those eye drops in children. So please see the doctor first before you use anything in the eyes of your baby. Is it okay to give vitamin A or vitamin C to wild babies? I already answered that question. You didn't say the age of the baby, but we don't recommend routine use of vitamin C in babies. Let your baby exclusive breastfeeding for the first 6 months. After the first 6 months, let them start taking complementary feeding while you keep breastfeeding, and give fruits. The vitamin C is in the fruits. Let them take the natural fruits and they'll get the vitamin C. Let them take the vegetables, they will get the vitamin C. And somebody is saying, what kind of yogurts? Unsweetened natural yogurts. And can I take my kids for routine checkup or wait for them to be sick? Okay, so that question is a very important question. Can you see that one now?
Yes, I can see.
Okay,
That's the last one.
that's the last question. So that question is important, but it varies from one country to another country. So, for example, in countries like the United States, every baby has their own pediatrician, and the pediatrician normally see the babies routinely. You go for routine checkup, whether the baby is sick or not. You see your pediatrician almost every year. You know, initially you see them even maybe every 6 months. But in countries like UK, you know, there's no law, so you see your pediatrician only when you're sick, because you will see your health visitors or GP for routine checks. So if you want to go to, in most government hospitals, if it's a baby that is born in that hospital, we will see them until 5 years. We do routine checks, but some people don't do it. So if you want to do it, you can do it. If you go to private hospitals, they're very happy to do it for you. It's okay to do it actually, but I would say it's best you do it anyway. But it's not compulsory. So you can also see your doctors when the baby is sick. All right. I think we are done.
Somebody just dropped one. I don't know if you
No.
should take that.
Okay.
Can I take that last one?
Okay, fine.
My 11 is the same. It's complementary feeding. My baby is 11 months. Is not feeding well.
The 8.5 kg, 8.5 kg is fine. It's not so bad for 11-month-old. You know, we expect it to be around 10 kilos, but 8.5 is still within normal. But if you want to know more about complementary feeding, please go to our Facebook group and go to the guide section, or just ask us about it in the Facebook group. Then we will lead you to the guide section, and then you can do a course. We have lovely videos, 5 to 7 minute videos. It tells you what to give, how to give it, how often to give it. Very detailed, very, very lovely. I think if you do it, for those who have done it, if you do it and you follow it, you will know how to do it. You know how to do complementary feeding without all the stress. And that's why I always recommend it, because it's easier when you watch these videos, and they use typical Nigerian setting videos. It's not like you have to be high class. No, the normal food we eat every day. That is what you don't need to buy anything from the shop. Everything is from your kitchen, and your baby will be fine. So that is what we recommend. All right. So thank you so much. We've gone about 30 almost 30 minutes past the hour. Well, thank you, Blessing, for joining me. I know it was quite hard for you. All right. Thank you to everyone those who are watching us on Facebook, on Instagram, on YouTube. And for those of you who are still dropping your question and we can't take, sorry about that. Our time is gone. But if you still have questions, go to our Ask the Pediatricians Facebook group. You can drop your questions there from Mondays to Saturdays. 24 hours we answer your questions. So feel free to drop your questions. Somebody will be answering it for you. And Ask the Pediatrician Foundation is not just about online. We also do community medical outreaches. And for May, we'll be going to the schools to support our schools against COVID-19, how to protect them. So if you want to be part of our outreaches, please check our all our platforms. You will see our account numbers and details there. Please support us, as we're going to 500 schools in Nigeria. That's a lot. So we will appreciate your support. So thank you so much for joining us, and we'll see you again same time next week. I'm bringing Dr. Oge Idika. She's a consultant pediatric surgeon. So we'll be doing surgical questions next week. So get ready and watch out for that. Thank you so much. Right. Bye, Blessing.
Bye.
All right. Let's end the broadcast.
Nice.
Good night.